Hi, everyone. Welcome to the Friday briefing, June 5th. Another week in the books here shortly, and another week to more openings, closer to more openings and getting back to somewhat of a normal lifestyle. So we're plus 55 at 2299 on confirmed cases. We're continuing to see these jumps. We unfortunately have to report 4 more deaths. We're at 88. Last reporting, we're at 84. Continue to see that age group of 30 to 39, and that might just be that they're getting tested, but it is the largest group. And then we have added, or health has added, an additional category of those under the 18 of where they're at. So you can see the 10 to 19, we had 111, and the 0 to 9, 72, and unfortunately no deaths in that age range. So just another bit of information out there for you. We continue to see the cases go up and down. We've got 66 COVID patients right now. 21 of those 66 are in ICU, and we can see that the ICU beds are 61% filled right now, which has been fluctuating. We want to see that on a down trend. We were getting down on the ICU beds for COVID to 21 earlier, and now we see it back up a little bit. Next one, Ellie. We're positivity rate is at 5.9, which is great. The total patients tested approaching 40,000, and I think health is doing a great job. I think we continue to be one of the leaders per capita on that. In the average days to results are at 1.7. We want to see those continue to come down, and hopefully they will. We have the cases by city. Again, meaningless information, but something to look at if you're interested. And then obviously the thing that just strikes me, is really the amount of deaths by those in long-term care facility at 59 of that 88. Certainly the highest ratio that we have. Just some other interesting information, and I think we started to talk about this today, but just to underscore the fact that, excuse me, we still have cases, and we're still very concerned about where we're at in the cases as far as per 100,000 over the last 14 days. We rank number 2, number 1 being Marin County at 60.6, San Mateo County being 52.7. Then we have Alameda County at 50.2. Then San Francisco, 32 per 100,000. Contra Costa, 21.2. And Santa Clara at 13.6. So we have got a ways to go. It's still actively spreading, obviously, in our county. Something that we're concerned about. We got to make sure that people adhere to the social distancing and make sure that they wear face coverings as directed, and just really understand that it's still out there, it's still active, and it's still spreading. We're, I think, number 9 in the state, and this is something that you never want to get to number 1 on. You want to be, obviously at the low end of this, and we got a ways to go to get there. In addition to that, just some updates on the Great Plates program. We have almost 1,300 participants in that program now, 60 contracted restaurants, and this has really been a real boost to them. We have pumped back 1.1 million into the restaurant industry in this county because of the Great Plates program, which is terrific. So we do have, as all of you know, modified shelter-in-place orders as of Thursday, June 4th. And they really relate to outdoor dining at restaurants and charter boats, along with funerals. You can go from up to 25 on the outdoor, and you can really visit if you want to get the full breadth and depth of it, the county health website to get the full orders. We also have David on the line, David, is there anything that you would like to add to those orders?
No, I think that's a good summary. There are a lot of requirements in place for restaurants in order for them to resume outdoor dining. And also there may be a little bit of a lag time because, cities, to the extent that they want to loosen requirements on restaurants to allow more outdoor dining, they may need to respond to the order and make some adjustments to their ordinances.
Okay, and we do have a group here working from health to work with the restaurants, to work with the cities, to try to coordinate that. Obviously, it's going to be city by city what they do allow in outdoor forums, but we want to make sure that we have a element for them on the health side of things so they understand what's the requirement there. So with that, why don't we go ahead and open it up for questions, Ellie?
Yeah, so if you'd like to submit a question, you can go ahead and type it into the chat box or press the participant icon, and there's a button that says raise hand. You can press that button to raise your hand. And I see Henrietta Burrows, you've been unmuted.
Henrietta, I always look forward to your questions.
Thank you so much again. I have two. And one, what is it about San Mateo County? What's happening in the county that would explain the high rate of COVID cases right now compared to the other counties?
Yeah, good question. Sarija, do you have any thoughts on that?
Hi, Henrietta. It's Sarija from County Health. And a couple thoughts. Number one, we do have an older demographic in San Mateo County than most other counties in the state. I believe when you look at our proportions of older adults, we are among the first or second in terms of those demographics. Second, County Health and many partners have really focused on prioritizing testing at the places that have a high number of folks with underlying medical conditions or who are older adults, including our congregate facilities. So a lot of our proactive testing, even testing of folks who are asymptomatic, have been in settings that would enable us to find cases. So you might notice when the state publishes its data, our positivity rate of cases among those tested is higher than many other jurisdictions. We've chosen to prioritize settings in which there is underlying risk so that we can respond quickly and protectively and supportively to prevent the spread of disease in the places where it could spread the most quickly.
And I got to say, I'm really proud of health and all they've done in the congregate care facilities. We would be in much worse shape if it was not for their proactive efforts to get in there and really work with the staff and do proactive testing and separate people and make sure that they have the proper PPE and all the work they've done in there. Again, it's not our obligation to do that. It's really a state obligation, but these folks live in our county and they have taken it upon themselves to do that at a considerable cost, I might add.
Well, it seems the testing is one thing. The testing might be revealing the cases, but even without testing, if COVID-19 is present, the rate of those infected would be higher in other counties, wouldn't they be, even without the testing, if COVID-19 were present?
We wouldn't know about the positivity without the test. So just to be clear on...
Just through hospital admissions, right?
Well, some would be asymptomatic. And I think, certainly that would be.
And even with a hospitalization, if there are folks that would fit the profile that they may be COVID-19, a test would need to be ordered for us to attribute that condition to the person.
I see. Now my second question, with restaurants being able to open and have outdoor dining, what about the restaurant? The restroom facilities?
Yeah, David, I would assume that, what's the situation there?
So basically, the way the order is written is that they can open their restroom facilities and folks can go into the restaurant for the purpose of using restroom facilities. They need to make either hand sanitizer or hand washing stations available outside, but folks can go into the restaurants in order to use the restrooms, and the restrooms need to be cleaned and sterilized regularly.
Several people can gather.
I'm not sure I understand what you mean. Do you mean that multiple people could go in the restroom at the same time?
Yes.
I mean, we would expect them to manage their restrooms so that folks could maintain social distancing. Gathering of any number of people outside of a household remains prohibited by both the state and the county order. So, I mean, people aren't allowed to gather.
Okay, thank you.
Great, thank you.
Next question, I see Sierra Lopez. You have your hand raised. I'm gonna go ahead and unmute you.
Sierra?
Hi, thank you. Sierra Lopez, I'm with the Daily Journal. I have a few questions. The first is pertaining to where we're at in phase 2. I went ahead and put it in the chat box, but I'm curious in where we're at in phase 2, and if there's other businesses or areas where people gather that are going to be opened before we reach phase 3.
Well,
Do you want me to take that, Mike?
yeah, please do.
So there's a lot of confusing terminology out there. When you say phase 2, I assume you mean the state's stage 2. So I think that the shortest, simplest answer is we are as open as state law allows us to be open. And as far as what was originally in the state's stage 2, all of that is open. There are businesses that were originally considered part of the state's stage 2, including in-restaurant dining. Excuse me, strike that. There are other things that were originally considered part of the state stage 3, including in-restaurant dining and hair, that variance counties can open now, even though technically, and I know this is confusing. I hope it's not confusing because I'm making it confusing. It's not simple. Restaurants and hair used to be part of stage 3. Technically, we're not in stage 3, but the state has allowed variance counties to open them, and we are not a variance county, and we're not eligible to be a variance county. Does that make? I'm trying to make it simple. Does that make sense?
Yeah, definitely. What would then have to happen for us to reach qualifications to become a variance county in that case?
Yeah, this just gets more and more complicated. So the variance process is on the state's website, and I'm not punting. It's just there are a lot of metrics and preparedness requirements, some of which are completely outside of our control, that need to be met to qualify for a variance. And you can find them all on covid19.ca.gov /roadmap /county, roadmap -counties. And then in addition, and I'm sorry, I lose track of weeks, not this Tuesday, but the prior Tuesday, there was a detailed presentation on those criteria by the health system. And I know that presentation is available on the county board's website, and that would be way more useful to listen to than to have me try and muddle through it. Is that responsive?
Yeah, thank you. I have a few other questions if you want me to, if that's okay.
Sure, please go.
Okay. So we've had a series of fairly large gatherings within the county recently due to the political climate. And I was interested in hearing if the county is doing anything to prepare for a possible surge, and what if there's been any monitoring of the situation that's going to help make decisions moving forward.
Yeah, I mean, a couple of things. One, county health is put out a lot of information on this, and we're happy to send that to you to incorporate any message you want to get out, because I think it's an important message and people need to take precautions. Additionally, we really don't know what the impact will be, right? I mean, it depends what kind of precautions people took when they were there. If people were yelling and certainly, without a face covering or exposed to that, that's more dangerous than even talking. But we won't know for probably 2 or 3 weeks. Certainly, we are ready for the surge. If you look at our numbers, whether it comes because of this, we hope not, or because of on the natural in July or August, September in the future, we've got a lot of capacity in beds and certainly ventilators. But we hope to never get there, and that's the message. I mean, people have to understand that we really fully support their right to protest. I was at both protests, but they have to take precautions too, and they have to make a judgment decision on how it's going to impact them potentially and their family members. So there is good information out there, and we're happy to send that to you. Michelle, maybe we can send that out just to circulate it. I hope that was responsive to your question.
It was, thank you. We've also received quite a few questions about church gatherings, and comparing them to the recent protests and the large gatherings there. People are still being recommended to not attend church. Do you have any clarifying information on that? Are you still recommending people stay away from churches?
So would you like me to take that, Mike?
Yeah, please.
So as to both protests and church, what the county did was it adopted what the state allows. And I'm sure I'm going to get a follow-up question, which I deserve, but what the state has allowed is, with respect to both protests and church, is no more than 100 people. Or 25% of capacity. So that comes from the state. And we adopted that in our order. And the reason for that, although Dr. Morrow would be a much better source of information than I, is that gatherings of any size, especially gatherings that involve things like singing and chanting, yelling, those types of gatherings, especially those indoors, are extremely risky for transmission of the virus. So I recognize that there are way more people out in these protests than are allowed by either the state order or what we've adopted in our county order. But as the county manager indicated, the county is supportive of people expressing themselves and protesting where appropriate.
I do want to just add that, thank you, David. This is Srija from County Health. Dr. Morrow has had the opportunity to speak with many faith leaders over the last week in smaller and larger Zoom or electronic meetings to try to relay our health concern about gatherings. Of course, we respect every religious leader's choices in coming to the decisions that are best for their congregations or their faith communities. But to be in dialogue and in learning and in solidarity about the health of everyone that we so value.
And I would just add to that, at least in a church setting, there are some, there's ability to somewhat separate people if they choose to move forward with that. And whether it's roping off benches or chairs, whatever it may be. In the protest setting that I was at, in both of them, it's very difficult to do that. People were very, very close. The good thing is that the vast majority of people I saw there were wearing face coverings. So that's at least some help. Anything else here?
No, you covered my questions. Thank you. I really appreciate that.
Not a problem. Thank you. Any other questions? All right. We're looking good. We're ending a week here. Thank you very much all for joining. Hopefully you will have a safe weekend and stay healthy. We'll be back Wednesday. We'll probably next week start to go to 1 day a week on Wednesdays to give you the updates. So until then, take care.